All right, so welcome everyone, and thank you for attending this webinar presented by the National Association of Community Health Workers Leaders in Community Health Project on how to establish and grow a community health worker network. And these are our presenters on the right here. I guess to introduce myself, my name is Jane Berry, and I'm the project coordinator for the project on leaders in community health that NACHW is currently organizing with funding and support from the Johnson & Johnson Foundation. And I am, I guess, the co-project coordinator now. I will be passing it on to a fellow colleague of NACHW in the later half of 2021. And then we will have a brief presentation from another member of NACHW, Aurora GrantWingate, who is the member and partner engagement coordinator, and also from one of the community health worker leaders of our project, Lucia Calindres. All right, so to get started, here are the learning objectives for today. The first is to learn about the project that I just mentioned and how we are promoting community health worker professional identity, policy leadership, and organizational capacity throughout the goals of this project. The second is to learn about the National Association of Community Health Workers' efforts to engage networks and associations during COVID-19 and how those organizations can get involved with NACHW going forward. And then finally, from the presentation from Lucia, learn about the journey of a CHW leader to establish a network for community health workers and discover best practices for growing a community health worker network from the ground up. All right, so to give you some background on the NACHW CHW Leadership and Capacity Building Project, which I mentioned, this webinar is a part of our project, and in particular, one of our project goals. So I'll go a little bit into the background, the origins of the project, and what our current efforts are. The project came out of a report from the Robert Wood Johnson Foundation Culture of Health Leader Initiative, which was focused on exploring the mediators and moderators of community health worker policy leadership. And it included interviews with 10 community health workers from across the US who shared their opinions and thoughts on the allies in participating in policy and also advocacy and research opportunities, how stakeholders and funding in particular could be barriers or could be promoters of participation in policy and in advocacy. And that really built the foundation of this project, along with some key interviews that NACHW was doing throughout the course of the pandemic, speaking with community health workers across the country while they were dealing with the pandemic and in particular sustainability challenges during this time. And from some of the listening sessions that NACHW did with these community health workers, we were able to identify professional identity, policy leadership, and organizational capacity as the three key themes to CHW sustainability that were coming out of those interviews. And those were also some themes that were shared with the interviews that came out of the Robert Wood Johnson initiative report. So there was a lot of confluence there of those themes. So we decided to take those themes and really explore them. And so NACHW drew up a concept paper and then was able to secure funding from Johnson & Johnson for this concept paper. That was the origin of our project. All right, I'm going to briefly stop the sharing of the PowerPoint just so that I can transition to a word from contacts at Johnson who would like to share just a brief word about Johnson & Johnson's participation in this project.
Hi, my name is George Leone from the Johnson & Johnson Global Community Impact Group. It's my distinct pleasure to welcome you to the launch of NACHW's National CHW Leadership and Capacity Building Project. One of the common threads through Johnson & Johnson's 130-year history as a company has been our continued steadfast support for nurses, midwives, and community health workers around the world. From our founding days, we have marveled at the heroics of frontline healthcare workers and the Herculean efforts they put forward each day to care for our communities. We want to support community health workers and grow them as a profession. As the last year has reminded us, having well-supported community health workers is a key to the health of our communities. This is especially true in communities of color, where we continue to see tragic health disparities. For centuries, people of color have been born with shorter life expectancies than white Americans and have been more likely to be living in fair or poor health. We believe we cannot have justice in society until we have justice in healthcare. That's why last year, Johnson & Johnson announced a new initiative entitled Our Race to Health Equity. Through this initiative, we aspire to help eradicate racial and social injustice as a public health threat by eliminating health inequities for people of color. One key way we're doing that is by investing in culturally competent community care models and supporting community health workers and the important work that you do. So thank you for your courage and dedication to your communities. We are proud to play a role in supporting you and all community health workers as we work to transform community health and achieve health equity. Thank you for attending today's event, and I hope that you enjoy it.
All right, it was great to hear that from George, who, yes, he mentioned this was part of the project is supported by the Johnson & Johnson Race to Health Equity initiative. So that is where the project has gotten support from. So after we had drawn up the concept paper for this project, our next step was to recruit a group of community health worker leaders who are going to serve as our advisors and also would lead all of the initiatives. So everything from the goals to the inputs and outputs of our project, all of that would be led by this group of community health worker leaders from across the nation. And many of them were recruited from the Robert Wood Johnson Foundation reports that I mentioned in the previous slide. So they were already familiar with a lot of the themes of the project and had agreed to establish contracts with us for a year for this project in November of 2020. And at that point, they were also introduced to the project and its scope and its goals. And finally, during that first meeting in December, we're asked to identify their skill sets and roles within their organizations and communities so that we could really integrate them properly into this project and find the things that they really excelled at and could apply their strengths to with this project. Here's a brief outline of our project approach. I won't go too in depth into every single one of these, but I think the biggest thing to emphasize is that all of the outputs and the goals of this project were born out of the concerns from community health workers and will be driven by their goals and desires in order to shape the profession and to grow their capacity both on an organizational and an individual basis. And we want to make sure that all of that is really built into the foundation of the project itself. So here's a list of our leaders from across the country. You can see they represent many different states, many different communities, different groups, and we're really grateful to have them all participating in a leadership role throughout this project. So after we got the group of community health worker leaders together, our first meeting was in January of 2020, where our leaders volunteered to be members of subcommittees or work groups based on the 3 project goals. And that each meeting would have a facilitator, so that's the project coordinator, plus each of the subgroups would be sharing their project progress throughout the course of the project and throughout the monthly meetings. So far, what we have been working on with these monthly meetings, we've been able to establish a set of group norms for the project that was developed by all of the community health worker leaders and facilitated by one of our leaders who has a lot of experience in that kind of thing and really showed his strengths and provided his strengths to us. We have put together a list of individual and capacity building goals, which I will share with you all later as it leads directly into the big presentation that this webinar is putting forward. And then we have also put together themes and questions for both the National Community Health Worker Survey and for non-community health worker interviews that we want to do to gain insight into how public health leaders and government officials see community health workers and how we can bridge the gap in understanding of community health workers. As I mentioned before, these are our work groups. So this is how each of our leaders have generously agreed to contribute their time, their passion, and their strengths to this project. And that is everything on the project front. I will now turn it over to my colleague, Aurora GrantWingate, who is going to share a little bit more about NACHW and NACHW's efforts to build the organizational capacity of community health worker associations and organizations. So Aurora, please take it away.
Hello, thank you so much, Jane, and thank you for everyone for being here on this end of Friday afternoon. Jane, you can go ahead and go to the next slide. As many of you may know, as all of you know, community health workers are trusted messengers by their community. Jane, you can actually go to, I think, the next slide. I just wanted to spend a minute talking about kind of NACHW's shared vision for community health workers to be united nationally to support communities in achieving health equity and social justice. We do this through our 5 core principles of engaging CHWs, allies, supporters, partners, sponsors, and influencers, expanding our membership recognition and opportunities for CHWs, enhancing CHW's leadership and skills, and advancing opportunities, educating key stakeholders on the impact of CHWs, and establishing a national voice and sustainable strategies on issues related to the CHW workforce. Next slide, please. And I just wanted to spend a minute talking about how NACHW defines a CHW kind of network or association. A CHW network is a community-based organization with leadership and or membership that is comprised of 50% or more of CHW and whose mission and activities focus on workforce development, mentoring, member mobilization, and advocacy. One of the ways that we work to engage with CHW networks is that at the beginning of the pandemic in March 2020, NACHW began to hold almost monthly town hall calls with CHW networks, associations, coalitions, and other CHW organizations to discuss kind of new developments in policy, funding, and challenges specific to COVID-19 in the CHW workforce. We have now done over a dozen of these calls, including one today. And we have learned so much from all the great work everyone is doing on the ground. NACHW always wants to be hearing from what folks are doing and what they need. Next slide, please. So back in April at our CHW Town Hall, we asked some registration questions just to get a sense of some of the support CHW networks would like to see from NACHW. As you can see, there are about 19 responses. The vast majority were CHWs. And the vast majority were from CHW networks, associations, coalitions, and some other kind of various CHW organizations. Next slide, please. The first question we asked was, please indicate your needs for the following type of funds to increase and improve your COVID-19 response. 66% said funding for staff. A little over half said policy and advocacy development and program and services funding. Exactly half said operations like data and website and leadership development. And then 44% said infrastructure, board development, and communications. Next slide, please. And then we also asked what supports would the CHW networks like to see NACHW be providing. And the vast majority have said help to secure sustainable funding, 63% said evidence-based resources, 52% said help with state level CHW policy and language to promote the CHW profession, 47% said help to use the NACHW Document Resource Center and help to develop partnerships with local public health. And then just 3 said help with CHW core competency, also called the C3 project, which you can find on our website. Next slide, please. For any of you who are not already members, we always invite membership. Membership for individual CHW starts at $20. We also offer individual allyship memberships and organizational memberships for both CHW networks and for ally organizations. Next slide, please. NACHW wants to be engaging with either folks who are already a CHW network or folks who are building CHW network. So as I just said, we always invite membership. We also have a free newsletter, which you can sign up for on our website. If you are having meetings, either official ones for a CHW network that is already set up, we would happy to be sit in, or if you're having meetings where you're trying to gauge interest in build your CHW network. We'd love to sit in and just hear about people's goals and concerns and see how NACHW can be helping increase your capacity. We're also happy to do an individual one-on-one meeting to see what your goals are for the next year and how we can support. We're always happy to elevate your webinars, meetings, conferences. I'm also happy to connect you with any kind of relevant COVID-19 resources. And there's my email, and I'll put that in the chat as well. Next slide. Thank you. This is the last thing for me. At the end of July, NACHW will be having our annual conference and meeting. It's July 28th and 29th. Registration is now open. I will put that link in the chat as well. There are also scholarship options available to anyone who needs it. We hope to see many of you there. That's all from me. Thank you all for coming. I'm gonna pass it back to Jane. Thank you.
Thank you so much, Aurora, for sharing those opportunities. And as she emphasized, yeah, please connect with NACHW on any of the various levels that Aurora outlined in her slides. We would love to hear from you, and in particular would love your participation at the Unity Conference. So yeah, please connect with us. All right, so going back to our project and to the presentation from our CHW leader, I think I mentioned before that I would come back to our capacity building goal, which is part of why this webinar was built and was put together for this presentation today. So our capacity building goal really centers around the ability for community health workers who are participating in our project to build capacity and to share that capacity then with the community health workers that they know that they are connected with and that they work with through associations and organizations. So that started during a project meeting where we had a poll to evaluate the leader's current skill set, as I mentioned earlier. And then we put together a list of capacity building opportunities that we wanted to present to our community health worker leaders. I have a list of those in the following slides, which we can briefly touch on. But mostly we wanted the community health worker leaders in our group to identify what their biggest priorities were in the participation of this project, both on an individual goal and an individual basis and on a sort of organizational basis, the things that they really wanted to take out of this project and bring back to, as I mentioned, other community health workers that they know and that they learn from and interact with. So when asked to describe their individual capacity building goals, the biggest things that our community health worker leaders identified was learning from each other first and foremost. So participating in the project also meant meeting other CHW leaders from across the nation who are all each doing incredible things and advocating for themselves and for their profession in states and counties across the US. So doing that sort of professional development on a personal basis, and also just growing an understanding of the roles and identities of community health workers from each other and from the work that we are doing throughout this project. And then finally, discussing with other CHWs best practices and becoming more agile and addressing systemic barriers and expanding the CHW capacity. And then this is a little bit about the collective capacity building goals. I think the biggest thing to take out of this was the recognition of CHW work and amplifying leadership roles. And so a part of that was participation and presentations from our CHW leaders, including the one that Lucia will be giving today. So this presentation really grew out of the desire of our CHW leaders in the project to present their knowledge and share their knowledge and their experiences with other CHWs. So with that, here is a list of our capacity building opportunities. So these are some of the things that we have offered to our CHW leaders so far, including, as I mentioned, the webinar today. And I believe, yeah, that's everything about the project. And as a good lead-in, I hope, this is a wonderful capacity building opportunity for any community health worker leaders or community health workers in general who are looking to build an association to learn from someone who has done it and done it so well and is now leading the association that she helped to start. So Lucia, without further ado, please take it away.
Thank you. Thank you. So, you know, this is a privilege to be able to provide and share information related to our journey. So I'm really excited to be among such amazing company, right? Our own community health workers. And we tend to do things differently. And I hope that I don't bore you with my presentation this afternoon because it's Friday afternoon, right? So I wanted to say, you know, good morning to those who are somewhere else when it's morning, and good afternoon to those who are in the afternoon. So my name is Lucia Colindres, and I am the Executive Director of the Community Health Workers Association of Rochester. We are in upstate New York. And I'm also one of the founders of the association. If you can go to the next slide, please. So what I'm going to be talking about today is I'm going to give you an overview on how we got started, sort of like our history, where we are right now, what our mission is, our purpose, and also best practice if you're trying to get started yourself. It really has been a journey of 22 years, and we're very proud of all the work that we have done. It has not been easy, but it also has been so much fun. I mean, it's one of the best work I've ever done. I want to give thanks to a couple of people, Darrell Fox and Dwayne Monroe. So how we got started really was we had Darrell, who was traveling across the country and was talking to people about different community health worker programs about getting started. And I went to one of his meetings and I was just like engaged, right? And from then on, we just sort of took off. And it wasn't just me, there was a group of us. So I'm gonna talk about our journey and hopefully you'll get inspired too, like I did when I heard Darrell talk about how to get organized and why it was important. So the Community Health Workers Association of Rochester is an organization that advocates to strengthen, so that's our #1 priority, the profession, because we are healthcare professions, and the leadership of community health workers, which we need to continue to grow, right? Many of our programs are developed and run, and we need to make sure that we create a pipeline so that we can have more opportunities for community health workers, not only doing the direct work, but also become those leaders and supervisors. We are a non-for-profit organization. We were established in 1999. So remember that, 1999, right? But we did not become a 105c3 organization until 2015. So that was a journey of about 16 years, if I'm doing the math correctly, right? So we started as volunteers. We started as, getting organized. Our first meeting was held at the basement of a church. Only 3 people showed up. I was one of the 3 people, and I was extremely discouraged. But what we did is we got together and we planned. So the next meeting, we would have more attendees, right? Our organization has always been led primarily by community health workers for community health workers. We have some funding, and we were able to get revenue through our training program. We now offer a community health workers field training. We do some consulting, and also we have some contracted services, which brings us some revenue. We have a membership, over 170 members that are community health workers. Now we know that the titles, right? We have different titles. So those could be peers, navigators, outreach workers, and so on, but they have the same scope of practice, right? And that is in the Finger Lakes region. So that includes rural and also city. We are dedicated to advancing the workforce through advocacy, program development, building and supporting CHW work standards, and scope of practice. Scope of practice is extremely important to us because we are professionals, and we want to make sure that others who are starting off understand what that means. And the core elements of who makes a community health worker, right? We established CHW as, we also want to establish CHWs as integral members of health reform innovations, right? So we're not just doing the work, we want to contribute. We want to let others know what we think, what our experience has been, and how we think we can move forward to improve healthcare outcomes. We also support collaborations between community health workers and health and human services agencies. Next. So I told you a little bit about who we are, and I want to share with you sort of like our governance structure. And this has evolved throughout the years. But we always, the way we started is with a board of directors. So we have always had a board of directors. Back then we established bylaws, and I didn't even know what bylaws were. So I learned, you know, through just, you know, learning, asking questions, you know, how to move forward with some of those things. So our board of directors is crucial, and is the group of people that really manage, you know, the organization and lead the organization, 100% led by community health workers. As you can see next to it, we have our community health worker students. And what we have done is we have created a pipeline so that those students can also become part of the board of directors. And that way, we can continue to develop leadership for ourselves, right? We're not looking at levels of education. We're not looking at, you know, experience serving on a board. What we're looking for are committee, individuals from the community who are committed to making it better for our community. In addition to that, we also have our Community Health Workers Association members, which we interact with via emails, events, we held conferences, and different activities such as that. We also have an advisory council. So our advisory council is really that group of allies, right? So those are the people that can provide some advice to us, can advocate for us outside of that community health workers field. So they're extremely important because they can provide feedback to us, but also can disseminate the work that we're doing. And now we have our executive director position, training coordinator. We're developing the marketing director position, and also the outreach and volunteer director, which is a crucial position for us because we want to create opportunities for our community health workers to do outreach and participate in internship opportunities that maybe other organizations are not going to provide to them, especially if it's someone who is new in the field. They have no work experience, but they're from the community and they're amazing and connecting with people, and they're well connected in the community. And so through that, we have opportunities for leadership roles, you know, like I said, led by community health workers. We support community members to lead the way, right? Which is what we want. We want us community members to lead the way. And the training opportunities, not only does the training and the certification, but it's beyond that, right? It's providing the opportunity to practice the skill so that they are well prepared to be able to join the workforce. And opportunities to do advocacy. Next. So I told you a little bit about what we do. There are three main components. Training, like I said, leadership is huge for us. We develop a CHW field training. This is not your typical training. This is, you know, I remember back in the days when I started as a community health worker, my job provided me with the basic training related to prenatal care, breastfeeding, STDs, all those things, but they didn't tell me what it was like to go in a home visit, right? And so I learned from my own colleagues, from my own coworkers, what to do, what not to do, where to go, where people hung out, best ways of engaging people, building trust. And so this is that, it has that concept. We provide, these are provided by experienced community health workers in the field, and we have some amazing community health workers. I mean, the stories, we could write books about, you know, different things that we have done in the community to try to connect with individuals. And we're targeting diverse communities, right? We want members from our communities in underserved, underrepresented communities. So that includes someone who has a language barrier. That's okay, you know, we're gonna make it work. We're gonna figure out how to get them into the training. Someone who maybe has a history of incarceration. You know, those are the individuals that we need to get into the field to provide that true community service that we need, right? We have the clinical, we have the prevention, we need that connection with community members. Community outreach is the other component, you know, as a result of COVID-19, there's a lot of opportunities to do dissemination of information related to COVID testing and also COVID-19 vaccines. And we learn from others, so we're training them, but they're really training us as well, providing important information about how to disseminate information and how to make sure that we're targeting the community in a culturally relevant way, right? So that's extremely important. So it goes both ways, and respecting the fact that this individual, although new in the field, has knowledge already. Networking collaborations, we've been extremely busy. We have a Black Physicians Network, same with the Black Nurses Association. We have done some collaborations with them, with the Monroe County Health Department, different providers, other CBOs, and of course, NACHW. NACHW has been, I mean, for the past 2 years, we're just so extremely, I'm a person of faith, so I think of blessings, and they have been so instrumental in making sure that we stay up to speed with everything that's happening on a national level. Next. So the other piece, and this is the last piece to talk about, like, you know, another component that's extremely important to us is health equity and social justice. So COVID-19 vaccines, we know that there were some disparities related to access to testing in the beginning. So we dealt with that. And then access to vaccines, not only dealing with the fact that some people didn't want to take the vaccine or they weren't ready, but also access, right? Accessibility in their own communities by people from those communities. We also did some collaboration with the census. So we were dealing with COVID-19, and then at the same time we had the census, right? So we held an activity where we invited them to make sure that, you know, we were contributing to the community. So it's, you know, healthcare is beyond just addressing chronic conditions. Healthcare is everything, housing, it's, you know, governance, is education, all of those components. Language access was the big one that came up for us because the dissemination of COVID-19 information was going out primarily in English. So that was excluding other populations, such as the refugee or New Americans populations, deaf or hard of hearing individuals, and also farm workers. The other piece that was you know, a big component was the social justice and equity related to racism, right? So we have to call it what it is. There was a lot going on with racism. In Rochester, New York, we had a situation with Daniel Prude, who was someone who was dealing with mental health and was killed, basically. So dealing with, you know, all of those social issues have been extremely important without taking sides, but just having a presence. Next. So that's a lot. I just gave you a lot because we're really busy. But what I want to get to is how we got started, right? So that hopefully some of you who are thinking about, you know, maybe this goal seems too far away, that I know that if you are committed and you start small, you can do it. So some of the recommendations that I have is, you know, please make sure that it's led by community health workers. Sometimes there are people have good intentions, but at the end of the day, you have to make a decision on how you want to proceed with, you know, your leadership role. And it doesn't take many, it takes just a core group of people that are committed to the cause and sort of are really good at organizing. So start small, don't be afraid of that, that's okay. If you get a few people to attend the first couple of meetings, that's fine. I remember some people thought we were getting organized as a union, and that was not the point of what we wanted to do. We just wanted to come together. These days, it's easier because we can have Zoom meetings, right? So that makes it more convenient. Back in the days, we were, trying to come together and schedules were an issue. But now with Zoom, it makes it more convenient. Time availability and supervision support was a big one for us as well. Some of us had great conversations with our supervisors. Some of them, didn't want to involve their supervisors because they weren't going to be supportive. And so we held meetings after 5 p.m. when outside of working hours or during lunchtime. And that made it safe for other people that wanted to participate. Perseverance and courage is not that courage, because you're going to have obstacles in the way and you have to figure out how to not give up, right? Because your mission is to develop this organization that's going to support your profession. So ask for help and support. And we have NACHW that has provided a lot of support and guidance, and we can continue to do that. And I'll be happy to also talk to some of you if you're interested. Learn each other's strengths. So I am good at some things and not so great at other things. And I'm not a detail-oriented person, so I look for people who are detail-oriented to, cover some of the stuff that we need to do. We have someone who's extremely, amazing at marketing and outreach. And so, they're the people to support that sort of effort. Networking, grant writing, policy. You don't have to have all those pieces now to get started, but it is important to seek individuals that might have some of that knowledge, or reach out to some allies that can provide that support. Be mindful of partnerships. Those, networking, it's all about networking, right? Like today, I'm sure some of you are networking with each other. I do that all the time, and it has become extreme, something that has been an asset for us. And learn about possible resources that can support your group. When we first got started, we had no money. We weren't able to apply for grants or anything like that. So we had an organization that sort of sponsored us and put us in their budget, but we had the decision making of how to utilize that money. And so that was, an asset for us. We'd held baked good, sales. I think we had a car wash. We've done all kinds of stuff. We donated some of our own money. We had different ways, but in essence, we didn't really need a lot of money. We reached out to organizations to sponsor a conference that we wanted to put together. So the time that we spent on putting that together was really, the essence of it all, right? And then to support to sponsor that event came from somebody else. So, so those are just some ideas. Next, please. Next slide. And so, a couple more recommendations. So we decided that we needed to come up with a name for a network, right? So we talked about networks versus association. That was a decision that was made by the core group. And we decided we wanted to be an association. That term, even association, scared us because it seemed really formal. And without us really knowing, a lot about associations, we just went for it. And it paid off. I'm glad that we did. But you really have to come to consensus in how to utilize the name. We changed our name from ROA, which was Rochester Outreach Workers Association, to Community Health Workers Association, because we wanted to use the title Community Health Workers, and we wanted to be consistent with that, with the understanding that there are many titles under that as long as we're within the same scope. So the name, so that's fun, right? Or you can go into some crazy debates about why we think, it should be named this or that. What is your main objective? What is your main goal? That is probably the most crucial piece. What is it that you want to do with the association? Do you want to advocate for CHWs? Do you want to train CHWs? Do you want to have a networking opportunity with your CHW? That's how we started. We wanted to network with each other, and we wanted to talk about issues that weren't really relevant to chronic conditions, but more about us and our work and being in the community. Your mission and your vision, that's a fun activity to do. And again, you can get some support to develop that. It takes some strategic planning, but in essence, really, it can be very simple, right? But it does take some work because it will be the essence of your organization. Governance structure is another component. I actually became the founder. I was not originally the president. And then we had another president. I was an advisor at some point and had different roles, and different people played different roles throughout the years. And, it has worked out for us, but it took us some time to get to where we are at this moment. So, feel free to play around in how you want to get organized and how you want the structure of that to be. Bylaws are important because if you have a governing body, especially with a board as a non-for-profit organization, you do need to make sure that you have some things in place before you are fully when you fully become a non-for-profit organization. And the non-for-profit organization, comes with some responsibility. So I took that very seriously because I wanted to make sure that our board was fully prepared for the responsibility came with that, financial responsibility. Once you have some revenue, you are responsible to make sure that you're managing those funds correctly. And so the more knowledge you have, the better it is. To this day, I'm still learning. And our board is amazing. I mean, they are committed. Whenever we need to, put together a meeting, even if it's at 7 p.m., you don't have to do that. We do it because it works for us, right? We prioritize our jobs. I have another job. And we want to make sure that at the end of the day, we get things done for our association. We decided to go with the membership levels, community health workers, we have supervisors, allies, but we prioritize our community health workers because that is our essence, right? So they are our customers, our community health workers. We work for them. That's what we do. And we advocate for them. We decided not to ask for dues. We decided that, community health workers were already not earning a lot of money. And we did, even if it was $5, we went back and forth, how much do we charge? It was just not something that, we wanted to move forward with, and we found other ways to make it work. So, that's not something that we do now. And develop collaborations between associations, networks, and health and human service agencies, because they are going to be your partners. So those community health workers that work at the hospital, at the clinic, at, fairly qualified health centers, they're going to become your members. They're going to become part of your group. So it is important to sort of get people heads up and, sort of feel out how people are feeling about it, who wants to be part of it. And of course, you have to be very inclusive. You want to be inclusive of all groups so that you can have a well-rounded, diverse association. So on that note, I hope that this was helpful to some of you, and I will be open for questions.
Lucia, I want to thank you so much. I've been sitting here on this Friday afternoon, really enjoying the presentation. To all of our participants who have stayed, we had just a few moments ago up to 90 participants. It's a Friday afternoon. We know this has been a full week for everyone, but I just want to welcome you and thank you on behalf of the National Association of Community Health Workers for this excellent presentation, and for each of you who've taken time out to join us. A few of you were with us a couple of hours ago on another CHW Network call. NACHW is creating a community. It is our charge to unify CHWs across ethnicity, across geography, and across sector. In the time that we have remaining, we have a number of, first of all, well wishes and thanks. Lucy, I want to let you know that so much of what you have shared is resonating. People are so grateful for your presentation. They're talking about how comprehensive it is. They love your strategy for creating future board members and pathways to leadership. So there's much that people can take away. I want to lift up a couple of the questions, and let's try to get to 3 or 4 of them in this time. First, let's just talk about when you started. There are 2 questions. I'll group them together and then you can respond. One came from Nikki, and she was asking about your initial catchment area for targeting CHWs. We know that in your name, it says Rochester, but sort of how did it begin? And then Ricardo asks if there were groups or individuals that may have felt left out of your process, right? And how did you enlarge your tent? So just take us back to those early days and think about those 2 questions.
Yeah, so the great question. So the catchment area was started in Rochester. So we really focused on the city of Rochester, but then we realized that, well, we were a little afraid to move out of, to make it bigger at the beginning because it required more work and we were all volunteers. So we're like, if we stay within Rochester, that's more manageable versus like a regional. And New York City had already established their own network with Sergio Matos, that's a whole, that was much larger than us. But we started around the same time. And so then we realized that, there were a lot of people that were getting left out. So we expanded to Finger Lakes region, which seems to be sort of, it's more inclusive of other counties. And so Finger Lakes region could be 7 counties. And now we're not only addressing the needs of CHWs in the city, but also in the rural area, in the nearby rural area, without going into like Buffalo and Syracuse. So in New York, we're sort of, positioned in different areas. So I think 1 came out of fear. We didn't want to be too large. And 2, we realized we need to expand. Like we need to make sure that other CHWs can reach out to us. And in essence, anyone can become a community health worker with our group. But strategically is the Finger Lakes region. So I think you can play around with that depending on what your area is and where you live. The second.
And when you started, did you find that those first few who came to that first meeting, were they very diverse across Rochester, across different sectors, across different ethnicities? How were you sort of tracking that inclusiveness?
Yeah, so yes and no, because I think we left some out, right? So LGBTQ communities, just because in the community health service, in our group, we were so focused on healthcare. But healthcare is more than those chronic conditions. So we had groups that were, prenatal care. So all the prenatal care CHWs tend to work together because they're networking with each other. But then we realized, hey, there's HIV, there's community outreach in the city, dealing with violence. We have the migrant workers community. We have, here in Rochester, we have a pretty large community of refugee community. So we wanted to make sure that we reached out to them. So we started establishing some relationships with them. So, I think as we evolved and we got smarter, we started to look at what we were missing and start to bridge, we reach out to them to develop those relationships. So, and there's always more work to do for sure.
Perfect. I'm going to group the next 2 questions together, one from Juliana and one from Mary. And these questions can be Juliana is asking just about funding, right? If it's not membership dues, where is your funding coming from? And Mary is asking about sustainability. We could think about sustainability broadly. You've talked about leadership succession and creating pathways. That's a form of sustainability for the organization. So how does funding look for you over time as you've watched the organization grow? And what is sustainability for you? And how are you sort of tracking your own sustainability?
Yeah, so I wanted to answer the other question, which was about who was sort of not, how do I put this in a nice way? There were some people that weren't happy that we were getting organized. And primarily, I think it came out of fear of So what is that going to mean for us, for our program? And that was, there were a couple of supervisors that expressed concerns on why we were getting organized. Once we explained, to them that, hey, this is to better our profession, but also to create training opportunities for ourselves that you're not able to provide us with. I think we were able to make it better. And we also invited them to participate in, like we had a couple luncheon recognitions, and they were presenting at our luncheon recognition about their programs. And so, we were able to establish those relationships. So there were certainly some people that did not want us to get organized, but we had to get past that, because at the end of the day, we were going to do it anyways. And there was nothing they could really do because it was after hours, right? So it was outside of our working time. And we have the right to do that. So going back to funding, funding has been an issue because there were just no funding. Like this year has been really important. For the past 3 years is when we got going with funding opportunities, because we partner up with a local organization. It's called ABC HPOG program, and we were able to charge for the training. So they do the recruitment, individuals who are community members, low income, who are trying to get into the field, and they paid us for those students. But what we did is we invested that money into, and I don't mean investment into like a formal investment, but we saved our money, and we said, we're going to reinvest this in our community health workers. We're going to, host a luncheon. We're going to host a conference. We're going to sponsor some of our students that, maybe are not eligible for that program. And so we reinvested, and we were able to use those funds however we wanted to. We also partner up with the hospital at some point to sponsor for a conference. And we don't have a building, so we don't have expenses, right? So the revenues that we're receiving are really, we save a lot of money because our expenses are not that large. Basic things like phone and, rent and all those things, we don't have to worry about. So that's how we get to save some of that money. But, more and more we want to have our own space. So as we continue to grow, that will be the next step. I think with COVID-19, people were reaching out left and right to us. The county reached out, hey, can we partner with you? We'll pay you. Can you hire the CHW and you manage the money and you manage the outreach activities, and then we'll give you the money. And then you go ahead and do what you need to do. And so we did that. And that created some more revenue for us. We almost went after the HRSA grant, which was a really big one and scary. And I think moving forward, we'll do more of that. So for us, this has worked. I don't see, money has not been our main priority. And we've been able to sustain our organization for 22 years. Based on the work of volunteers, our own community members. That has been our approach. I don't know if that will work for some of the people here. But the fact that we're getting some compensation now and that we're able to manage, to pay for our own community health workers, it's such a great satisfaction to be able to give back and reinvest in ourselves.
Wow, this is just tremendous. I just want to underscore the point that you just made. You're right that everyone may not choose the option to not have a building and overhead costs, but the ability to take those funds that would go to those sort of costs and instead invest them in your members, in your leaders, in your activities, in your development is such a great strategy. I'm also so glad that you lifted up the partnerships that you've been able to develop. This last year and a half that we've been in the pandemic, I've watched you navigate and lead the development of these partnerships in your area. Some partners who came to you late, right? And you would have liked them to come to you earlier. And that's a recognition of a point you made earlier, that CHWs want to be involved upstream in the design and the development as leaders, as experts, not just as folks who are used. And that's a term that we see so often, but also you're developing strategic partnerships to help your community. You have your own goals and values, and you're able to develop partnerships to help achieve those ends. And this unprecedented time of American Rescue Plan funding, when we know that billions of dollars are going to come through our states, to our local and county health departments, to our federally qualified health centers for COVID work, for vaccine distribution, for social needs screenings, the strategy and the partnership you have to say, we can hire, because these are our members, right? We have a community of practice. We know who the experts are. We can supervise. We can create the strategy. I mean, that's lifting up the community expertise. And so I offer that to everyone on the call. We're almost out of time. I know that Benjamin was asking more about your leadership training. And so maybe what we'll do is create, get some links from you so that people can read more about your training and how people can either get a train the trainer or adopt your model or get some mentoring, because developing leadership pathways within our organization is a critical component of sustainability. I just want to say thank you, Lucia. I want to thank Jane, who has been our project manager and helped to lift up this event today. I want to thank Aurora for sharing with us the needs and concerns of CHW networks and associations from across the country. This is part of our capacity building series. Michaela is with us, another CHW leader. Her session will be coming up in August. You can look for more opportunities. Send your CHW peers and colleagues to the Unity Conference so that they can get connected to this mentoring, to this relationship building, and so that they can cultivate their own leadership and invest in the local networks, associations, and coalitions. Lucia, again, thank you for your expertise. This has been a great, great session. And a thank you all again who were able to stay through to a Friday afternoon. To all of our leaders across the country, I'm so grateful for this community of practice. To all my CHWs promotores, my peers, community health representatives, you are champions of the voices, the experience, the expertise of our communities. And I'm so grateful that we are lifting up and amplifying who we are, what we do, and the change that we want to see in the world. So I look forward to partnering with you throughout the coming weeks, months, and years. Have a wonderful weekend, everyone. Thank you so much. All the best to you. Stay safe.